Hema here from CSA Smart Group. It's a lovely day in Bradford. We have got a first snow today, and we had beautiful mind-blowing sessions yesterday, and I noticed a lot of things to let you know, guys, about a particular scenario when we see young children, young girls coming for pill start. So I thought about why can't I make a video while I'm just sipping my tea on the snowy day. That's why I'm doing this video. So keep watching. Bye. Hello friends, it's Hema here from CSA Smart Group, where we are dedicated to your success in your CSA exam. We had a coaching session yesterday, and some of my awesome students, they are finding it difficult to deal one of the cases, which some of us will be coming across in our day-to-day surgery. And that scenario is how to deal a teenager, like 14 or 15-year-old girl, who comes with a request for a pill. I noticed yesterday, some of my students are really struggling to address this scenario because they might not realize that they are talking to a 14-year or 15-year-old girl. They might use the same language as we used to deal with our adult patients. That was a bit surprising to me, because if we don't practice when we are practicing our scenario, who were doing the simulator, we have to act just like a 14 or 15-year-old kid. Because since we are doctors, we can, we just go with the flow, whatever the doctor candidate says. So it's very important to behave just like a 14 or 13 or 12-year-old kid. And then we have to raise the issue that if you don't understand, then we have to really pick it up and let them know that it's not quite a right way of language. So what I noticed yesterday is few things I noticed, like how to tailor language when we are speaking to your kid. Second thing is how to build a rapport with the kid, because sooner we build a rapport and make them feel comfortable, they will be they will have confidence in us and they will start opening up. So that's very important, to build a rapport quicker. And the third thing is, I notice some of my students are struggling into get the sexual abuse, child protection issues. They were struggling to question in a way that is very gentle and tailored to the kid's age. And then some of the students, I noticed they were struggling to explain how they are going to involve the social service. Some said that I'm duty bound to let the social service or police know, and some of us might start the conversation about this straight away, around third or fourth minute. So if we start doing like that, it would appear like a tug of war. The child will say oh no, you can't tell anybody, I just came for my pill, so I'm going away, I don't need that, I can pick the pills from sexual health clinic or something like that. Or sometimes the child may get offended if you don't get the rapport and try to break the news very gently, or if you're not explaining why we are really worried about and how responsible we are for the safety. If we don't explain those things in simple language so that the kid can understand, it's very difficult to run the scenario. And particularly when we are in exam, when we are in panicky mode, we lose our human nature, I think. And it is normal, isn't it? When we are getting panicking, it's very difficult for us to think and act. So I would strongly recommend you, my friends, please select some of the topics like this, with difficult language use, and the way how we have to use our body language and voice, everything, isn't it? So you have to plan. So make a list of all these tough cases which you may not come across as a GP trainee in your day-to-day surgery, but as you know, it's not very uncommon. So we have to make sure we practice all these cases and mentally prepare for this. And if you're in doubt, you can ask your GP trainers like how they deal with these cases, what sentences they would use, how they will tell the kid that they're going to involve the social service, something like that, and write it down. If you're like me, I would like to write it down. If I come across any nice statements, particularly when I'm watching TV, or when I'm seeing my colleagues handling the cases, or when I'm observing my GP trainers or program directors deal these cases, then I will quickly write those sentences and I will try to incorporate, practice, and try to use it in my own scenario. So let me quickly go through like step by step when we come across teenagers who come for pill. And as you all know, like if it's 13 and less than 13, it is illegal. And if it's more than 16, they are actually competent. So in between age group is a little bit difficult age group to deal with. But as a GP, we have our own responsibility for their safety. So we have to make sure, are they really sexually active? Is there any chance of pregnancy already, and are there anything else involved like drug or alcohol, how the kid is performing in the school, what the support network the kid got, like their home situation, parents, is there any problems with the parents, how the friends circle. So these are the simple things we may forget to ask. So it's very important to take it slowly, step by step. And then I noticed some of my students jumped on as soon as the kid told about the pill. They jumped on assuming that it is for contraception. Not necessary. The pill might be for sports or to lose weight. We don't know, isn't it? So it's very important to clarify what pill do they need. Then we can even ask do they know about the name of the pill, and we can clarify that. So it is a contraceptive birth control pill. Then we can ask how she come to know about the pill. Has she spoken to anybody like her friend? What does the friend know about the pill? What do they think about the pill? And we can even ask what does she think about having a sex? We can clarify that. Is it something you want to do, or are you ready to do? How do you feel about having a relationship at this age? Then we can ask how is everything going on in school? What's her plan? Just to make sure they are competent, And then we can ask about what about the boyfriend? Are they in a relationship now, or are they planning to have one sooner? And then how old is the boyfriend? How does she come across, in that relationship? Is there any pressurizing effect in the relationship, or any grooming going on? Does anybody know about their relationship? What else? Who is at home with her at the moment? Has she spoken to her mom? Or why she thinks she can't speak to her mom? What's happening with her? Has she got any elder sisters to talk to, or any best friends to talk to? Then we can ask how does she feel about having a boyfriend who is quite a lot older than her? Then we can ask do you feel that he's one of, for example, teachers, or is one of the uncles, or whatever, we can say that's the problem. Then we can say we slowly we can say it's nothing wrong with you, but I'm really worried about your boyfriend being a teacher in your school, because he has got a kind of responsibility for you as a teacher. You're his pupil, rather than having a relationship together. Then we can even say we can stress the point that we are really worried about what's going on behind the relationship. Is he just misusing her, or is there any other students involved? And we can say he's teacher at a school, you're quite young compared to him. Then we can even slightly say that you're not too late to have sex. You're just 14 and the legal age for sex is 16. Sometimes we can even say if you're actually breaking the law if you're having sex before that. but in a very gentle manner. There is no like a police interrogation. So it's very like a hearty chat with one-to-one human being, and we can stress the point like I'm just a little bit worried about you, that's all. I think because what you have said to me today, because of your age, because you're 14, you're having a relationship with one of your teachers, I think I probably need to let somebody know about this. Then we can say like she will be like, to whom are you going to say? Are you going to say tell my mom? Then we can say like, yes, simply because I'm really worried about not only your safety but also the kids in your other kids in your school, because we exactly don't know who else is involved, and we have to make sure to contact him and get more information so that we can make sure everybody is safe, and it's very important to get more details. And then we can say like, if the child asks about like, oh doctor, I thought it's everything confidential, then we can say like, yeah, of course everything is confidential between whatever we are talking, but if you're worried about your safety, then we are allowed to break that confidentiality and let proper people like social service know about what's happening. Not because to accuse the patient or nothing like that, but just to get more information and make sure the patient's safety is priority. Then if they ask about like, are you going to tell my mom and all, then we can say like, I know exactly what you're thinking, because you're really afraid what your mom might say, but believe me, mom in the whole world, mom is the best person to support you, and she would certainly understand how you felt and what you have gone through, and she might be the best person in the whole world to support you. And then we can say like, I understand that you don't want me to tell anyone, but as a doctor, it is my responsibility, if I'm worried about your safety, to tell somebody. Or one of my GP trainers told me like, we can even say like, for example, Lucy, it's not your fault, nothing is wrong with you, but we want to make sure whatever your teacher done is wrong, and we have to get more information, and we have to look into it in more detail so that we can make sure you and other kids are safe. Then we can say like, I think at the moment your mom would be worried about you just as I am. Then the likelihood is that I need to tell somebody. I would need to ring someone from social services, and you can make up story like, the Ruth, she's wonderful lady. You can wait in our reception. We have got some coffee, tea, magazines, biscuits there. Just wait for 10 to 15 minutes. I give her a ring, and she will come and have a chat with you, and let's see how best we can help you. Then I would normally say like, Lucy, don't worry about the pill, it's easy peasy. We can discuss about it in more detail. I need more information, how the pill is suitable to you, so we can arrange another meeting for that. In the meantime, I would advise not to have any sex or something like that. So this is the kind of scenario where we will get panicky if we don't practice. So I would strongly recommend that make a note of all these difficult scenarios, and try to practice with senior GPs, your GP trainers, even your program directors. They would be willing to help you to go through these scenarios, and take some personal responsibility to make our performance better, because nowadays like our performance, we shouldn't compromise in the quality of a care. Whichever we are offering, we should go for the best patient care. And as a GP, it's not only a medical care, but it's also the way how we deal them, their emotional need, their psychological need, everything, isn't it? So we have to make sure we are up to the mark, and we have to try our best to be the best among the best, right? So I'm here to help you to go through. And if you're having exams in the next few weeks, all the best from our CSA Smart Group family. And uh, please email me to cssmartgroup@gmail.com if you have any difficult topics in mind, if you think you need some extra support. And if you go through my CSA success packages, I have got lots of e-courses. You can go through them from the comfort of your home. We deal with like women's health made easy, sexual health made easy, diabetes, genetics with the done for you scripts, discussing with all the scenarios, possible scenarios, to make sure you are fully prepared. So please feel free to go through those e-courses and let me know if you're interested. I'm more than happy to help you through. And comment below the below this blog post and share your comments, get involved, visit our Facebook page, because our community is so happy to help you to go through this. So and share with your friends if you think somebody is struggling with the similar situations. So share it with them, help and support each other, and let's pass our CS exam with flying colors. Okay. Bye bye till we meet next time. Thank you. Bye bye.